Child Welfare Policy, the Family First Prevention Services Act. My name is Davia Graham. This course is Analysis of Social Service Policy 5218. Professor Dr. Lauren Anzaldo. This will be presented by Davia Graham. This presentation examines the federal child welfare policy, known as the Family First Prevention Services Act. The law represents one of the most significant reforms to the U.S. child welfare financing system in decades. Historically, federal funding emphasized foster care placements after children had already been removed from their homes. However, the Family First Prevention Services Act shifts the focus toward prevention by allowing states to use federal funding for evidence-based services that help families address challenges before removal becomes necessary. This presentation will analyze the policy using a social work framework. Specifically, it will examine the historical context of child welfare policy, the key provisions of the law, its impact at the micro, meso, and macro levels of practice, and its implications for diversity, equity, and social justice. The presentation also evaluates research, evidence related to prevention services, and identifies strengths and limitations of the policy in improving child well-being and family stability. Overview of child welfare policy. And this system is in place to protect children from abuse and neglect, provide services to strengthen families, ensure safe placements when removal is necessary, federal policy guide state child welfare systems. And the child welfare system in the United States is designed to protect children from abuse, neglect, and unsafe living conditions while supporting families experiencing crisis. The system includes services such as child protective investigations, foster care placements, family preservation services, and adoption assistance. Although the federal government establishes broad guidelines and funding structures, most child welfare programs are administered by state and local agencies. Historically, federal policy under the Title 4E of the Social Security Act provided significant funding to support foster care placements. However, far fewer federal resources were available for prevention services that could help families remain safely together. As a result, many researchers and policymakers argue that the funding structure unintentionally incentivizes removing children from their homes rather than supporting families earlier in the crisis process. Understanding the policy context is essential when examining why reforms, such as the Family First Prevention Services Act, were developed. Background of the policy, why reform was needed. Increasing foster care placements, over-reliance on residential group homes, limited prevention services, and concerns about outcomes for youth. The Family First Prevention Services Act was enacted in 2018 as part of the Bipartisan Budget Act, representing a major shift in federal child welfare policy. Researchers and policymakers have raised concerns for years that the child welfare system relies too heavily on foster care placements and residential treatment facilities. These settings can be necessary for some youth, but research shows that children generally experience better development outcomes when they remain safely with their families or in family-based placements. In addition, evidence suggests that many families involved in child welfare systems lack access to critical support services such as mental health counseling, substance abuse treatment, and parenting programs. Without these resources, problems often escalated until removal became the only perceived solution. The Family First Prevention Services Act was designed to address these issues by restructuring federal funding to prioritize prevention and family support services rather than institutional care. Key policy provisions, major components: federal funding for prevention services, evidence-based mental health programs, substance use treatment for parents, parenting skill development programs, and limits on group home placements. The Family First Prevention Services Act includes several key provisions focused on preventing children from entering foster care. First, the policy allows states to use federal funding for prevention services that support families before removal becomes necessary. It also funds evidence-based mental health programs and substance use treatment for parents to address common challenges that affect family stability. In addition, the Act supports parenting skills development programs that help caregivers build stronger and safer home environments. Finally, the policy limits the use of group homes and encourages placing children with relatives or foster families whenever possible for reforms that would focus more on prevention and family support. Policy across levels, policy implementation. State level, social workers deliver services to family. Federal level, state develop prevention service plans. Local level, establishes legislation and funding structures. The Family First Prevention Services Act operates across federal, state, and local levels. At the federal level, the government establishes the legislation and funding structure for prevention services. At the state level, states create prevention service plans that determine how the funding will be used and which programs will be implemented. At the local level, social workers and community agencies provide services directly to families, including mental health support, substance use treatment, and parenting programs. Diversity and disparities. Black children are overrepresented in foster care. Poverty strongly correlates with child welfare involvement. Cultural misunderstandings may influence investigations. Prevention services may reduce disparities. These are the inequities in child welfare. There are significant disparities within the child welfare system that affect certain communities more than others. For example, Black children are overrepresented in foster care systems compared to their proportion in the general population. Research also shows that poverty is strongly linked to child welfare involvement, meaning families with fewer economic resources are more likely to come into contact with the system. In addition, cultural misunderstandings between families and professionals can sometimes influence investigations and decision making. Policies like the Family First Prevention Service Act aim to address these issues by expanding prevention services that support families and may help reduce these disparities. Micro, meso, and macro impact. Micro is for direct services to families. Meso is agency and community programs. And macro is policy, advocacy, and legislative reform. The Family First Prevention Services Act impacts social work practices across multiple levels. At the micro level, the policy directly affects children and families by providing services that help parents address challenges such as substance use or mental health issues. At the meso level, community organizations and social service agencies receive funding to implement prevention programs and provide services to families in need. And at the macro level, the policy shapes national child welfare priorities and influences how federal funding is distributed across the state. Theoretical framework: ecological system theory, person and environment perspective, and trauma informed care. Several theoretical frameworks help explain the importance of policies like the Family First Prevention Services Act. First, ecological system theory explains how a child's development is influenced by multiple environments, including family, community, and social systems. Second, the person and environment perspective emphasizes understanding individuals within the context of their surrounding social, economic, and environmental conditions. Finally, trauma informed care recognizes that many children and families involved in the child welfare system have experienced trauma, and services should be designed to support healing and avoid further harm. Effectiveness of prevention. Prevention programs reduce foster care placements. Evidence based parenting programs improve family stability. Early intervention improves child development outcomes. Research shows that prevention services can significantly improve outcomes for families and children. Studies indicate that prevention programs help reduce the number of children entering foster care by addressing challenges within families before removal become necessary. Evidence-based parenting programs also help strengthen family stability by improving parenting skills and family relationships. Additionally, early intervention services support healthy child development and can reduce long-term risks for children and families. Policy strength, benefits of the policy. Focus on family preservation, investment in evidence-based programs, increased accountability in service delivery. The Family First Prevention Services Act has several key strengths that improve child welfare outcomes. It emphasizes family preservation, prioritizing keeping children safely with their families whenever possible. Secondly, the policy promotes investment in evidence-based programs, ensuring that funding supports services that have been proven to work. And finally, it increases accountability in services delivered by requiring monitoring and evaluation to ensure programs meet standards and effectively support families. Policy limitations, challenges. Uneven state implementation, workforce shortages in social services, limited availability of evidence-based programs in rural areas. Despite its strengths, the Family First Prevention Services Act faces several challenges. Implementation varies across states, leading to uneven access to prevention services. There are also workforce shortages in social services, which can limit the ability to deliver programs effectively. Additionally, rural areas often have limited availability of evidence-based programs, making it harder for families in these communities to benefit fully from the policy. Social justice and advocacy. Role of social workers. Advocate for policies that prioritize family preservation and prevention services, address racial disparities within the child welfare system, promote culturally responsive and trauma-informed services, support community-based prevention programs that strengthen families, advocate for increased funding and workforce development in child welfare services, and it also encourages collaboration between schools, healthcare providers, and social services. Social workers play a critical role in promoting social justice and advocating for families within the child welfare system. They advocate for the policies, prioritize for family preservation and prevention services, while working to address racial disparities that disproportionately affect children of color. Social workers also promote culturally responsive and trauma-informed services to ensure families receive support that respects their background and experiences. They support community-based prevention programs that strengthen families and advocate for increased funding and workforce development to improve service delivery. Finally, social workers encourage collaboration between schools, healthcare providers, and social services, creating a coordinated network to better support children and families. So, to conclude, we now understand a major shift toward prevention in U.S. child welfare policy. Federal funding supports mental health, substance use, and parenting programs. It encourages family based placements, including kinship care. Evidence based services improve family stability and reduce foster care placements. Implementation requires collaboration across federal, state, and local agencies. The Family First Prevention Services Act represents a significant shift in U.S. child welfare policy, focuses on prevention rather than reactive intervention. The policy allowed federal funding to support mental health treatment, substance use treatment, and parenting programs, helping families stay together whenever safely possible. It also encourages family based placements, such as kinship care rather than institutional group homes. By prioritizing evidence based services, the Act strengthens family stability and reduces the likelihood of children entering foster care. Successful implementation depends on strong collaboration between federal, state, and local agencies, ensuring that policy translates into meaningful support for family and children. Thank you so much for tuning in. I appreciate you listening to my PowerPoint presentation on child welfare policy, the Family First Prevention Services Act. Thank you.